Understanding your discharge can be very confusing. Here's a quick guide on what's normal and what's abnormal. Vaginal discharge is completely normal and it serves to clean and protect the vaginal canal. But the color, type, texture, and smell of your discharge can vary throughout your menstrual cycle and in certain infections. So what is normal? Clear, thin, watery discharge is very common and occurs through majority of your cycle. Clear, stretchy, egg white consistency type mucus generally occurs around the time of ovulation. It's also known as fertile mucus and it helps sperm to make its way to the egg. Creamy, milky type discharge can happen before ovulation or even in the luteal phase after ovulation. Generally speaking, your discharge should not have any color to it and it will fluctuate normally from day to day. There also shouldn't be any other symptoms associated with a normal discharge. An abnormal discharge, on the other hand, can indicate an infection or some other vaginal health issue. Thick, white, clumpy discharge resembling cottage cheese may be a sign of a yeast infection. You may also experience itching, redness, or burning with this type of discharge. You may need an antifungal medication, so speak to your doctor about this discharge. Thin, gray, almost off-white type of discharge that generally smells quite offensive, almost fishy, may be a sign of bacterial vaginosis. You may also experience itching or discomfort or burning with this discharge. BV is caused by an imbalance in the bacteria in the vaginal canal. Speak to your doctor about this one just to make sure that it is bacterial vaginosis, and you may need an antibiotic or some over-the-counter medication such as boric acid suppositories may help. A green or yellow discharge, especially if it's quite foamy or frothy and offensive smelling, may be a sign of an STI. Other symptoms may be itching, swelling, and pelvic pain or discomfort. A brown discharge or spotting is common after your period and may also occur when you are ovulating. The majority of the time, a brown discharge is normal, but if you're having other symptoms associated with the brown discharge, things like pain on intercourse, fever, or a positive pregnancy test, then it is important to speak to your doctor about a brown discharge. And remember, any discharge that is accompanied by a foul smell, itching, burning, or redness, pain, whether it's just pelvic pain on intercourse, or pain on urination, an unusual color like green or yellow, and if the discharge is persistent and changing in consistency, then speak to your doctor.